Hey lovelies, I thought I'd just jump on quickly between clients and just have a quick chat about potassium and how important potassium is in general health, but also how it is important for thyroid health. So where do we get potassium from and why do we need it? So potassium, we get it from like potatoes with their skin on, prunes, raisins, bananas, pretty much all fruit and veggies, apricots, avocados, bananas, all like nuts, mushrooms, meats, pumpkin, cauliflower. So it's pretty much everywhere. Hey Stacey Lou. So why do we need it? We need it because it needs to be along with our sodium and our chloride, and it's one of our electrolytes, and we need it for the conductivity in our cells to help them function. We also need it for our electrolyte balance, so our blood balance to as well. So we're looking at how things move along and flow. We're looking at body fluids. We're looking at the pressures within our body, so blood pressure. We're looking at edema and water retention. But it's also in regulating the frequency and degree which our muscles contract at. So we use magnesium a lot for muscle contraction, but that is also in balance with our potassium. So if we don't have enough potassium, our nerve endings get a little excited and they run around, and it's really not fun. So it really is. It's just eating really good, clean vegetables gets you enough potassium. You don't need to take a supplement for this guy at all in any shape, way or form. You just need to eat some veggies. Okay, so what are some of the signs that you might not have enough potassium in your system? Like heart problems, tachycardia, muscle weakness. Now some of these are really, really similar to magnesium as well. So constipation, depression, thirst, cognitive impairment, so that real foggy brain that you can get, acne, skin problems, bone and joint pain. See how we've got so many of our nutrients that have multiple functions, and which is why we just can't take a single supplement to balance everything. It really is that whole conjunction of eating good quality healthy food. Thyroid dysfunction, specifically hypothyroid, and also adrenal stress. And remember how we've talked about how adrenal stress and thyroid go hand in hand. It could be that there is some form of potassium not being used or utilized, or not eating enough. And it can come from the fact that you're not actually eating any vegetables. Now remember, if you've got what we call gut permeability, good old leaky gut, you might not actually be absorbing the nutrition that you need and require. Sorry about that. So what else should you know? The potassium gets absorbed through your intestinal tract, so through the small intestine. So it's got to go in your mouth, down to your stomach, from your stomach to your small intestine, and that's where it gets absorbed. And it gets excreted in your urine. What else? Let's see. You can get excessively high levels, but it's usually because you're taking a potassium supplement, or you're taking a supplement that has it in it. It can also show as tingling in the hands and feet. Now, tingling in the hands and feet can be seen as a lot of different things with magnesium. It can be seen in type 2 diabetes. It can be seen in thyroid disorder. It can be seen with adrenal stress. There's a whole lot. So usually a good old blood panel will really sort it out to see whether it's high, low, or exactly where it needs to be. You lose approximately 50% of your potassium through your cooking, and it's leached out in the water. So hey, why not just use the water you cook your veggies in and chuck it into a soup or into a crock pot and have a nice casserole or a stew. So guys, I hope you've had a little bit of information today about what potassium does and how it can benefit your health. I'll catch you all again tomorrow. Thanks for watching.